Continuing coverage this morning as we begin Breast Cancer Awareness Month. The Hampton Roads Health System is using artificial intelligence to help detect breast cancer. I got a behind-the-scenes look at the technology Riverside Health Systems is using. The AI scans mammograms for signs of cancer a radiologist may miss. This morning, I am shining a light on how the AI can save lives and the word of caution about using it in healthcare.
All of this for you. Yeah.
Tasha Cade's story struck a chord with our community this summer. She opened up to me about the breast cancer diagnosis she received while she was pregnant.
I had been doing my due diligence by going to see specialists, by getting my routine mammograms.
Were you angry?
Oh, I was beyond angry.
Data from the American Cancer Society reveals mammograms miss 1 in 8 breast cancers, and it usually happens to women like Tasha with dense breast tissue.
That tissue density can affect the ability for the mammogram to see it as well.
Dr. Benjamin Pettis is a radiologist within the Riverside Health System in Newport News. He's not connected to Tasha's case, but he is giving me a behind-the-scenes look at the artificial intelligence program Riverside is using to help catch signs of cancer on a mammogram a radiologist alone may miss.
So this AI offers a second set of eyes.
Yes.
But you're still making the decision.
Absolutely. It basically looks for the shapes and features associated with the cancer, and it can find it, very small, sometimes even smaller potentially than we can. It'll flag something as either an elevated risk, it gives us statistics likelihood that this could be something, or a sort of an intermediate risk. We're finding more and more people when it's basically a curable kind of situation. It's much less treatment, much better outcome.
When Riverside Health System patients receive their annual mammograms, the scan is now fed through the AI portal to help the radiologist analyze it at no additional charge to the patient.
Now having that secondary safety measure of, another set of eyes looking over it, I think reduces the chance for any human error, any fatigue.
An early-stage study published in The Lancet Oncology found that artificial intelligence cut doctors' mammogram reading workload almost in half. But a study by the Radiological Society of North America found that radiologists reading mammograms are prone to automation bias, meaning they could favor incorrect advice by the AI over their own judgment.
The AI, you said, is a tool. It is like having another physician in the room with you, a second set of eyes, but you want to caution other doctors not to just use it as a default.
Absolutely. I don't think we should ever do that. I personally think it's best to have it as a secondary, safety measure after we've done all of our work.
Use AI responsibly.
Right.
Dr. Pettis believes the AI's biggest benefit will be detecting cancer earlier in women like Tasha, whose cancer is more likely to be missed due to dense breast tissue.
Do you think this AI could help bridge the gap when it comes to those missed diagnoses?
I definitely hope that each of these advancements help bridge that gap, because we don't want any disparities, for sure.
As Tasha shared with me, she's an advocate for an extra set of eyes, even if it is AI.
It can mean the difference between life and death.
That one extra test.
That one extra test.
A quick update on Tasha Cade. She had one breast removed during pregnancy, and she is recovering from the second mastectomy she had this summer. She and her baby boy are doing well. As for the AI at Riverside, it was created by Transpera Breast Care, which also created the 3D imaging tool the hospital uses. So Dr. Pettis tells me that having those technologies working together is really helpful in detecting cancer in the very, very early stages.
That little bundle of joy. He is adorable too. Just
cutie
pinch
pie.
his cheeks. So we heard about Riverside, Jessica. Do we know, are there any other hospitals in our area using this kind of tech?
So I did reach out to Centera and Bon Secours, and both systems tell me they are not yet using AI to detect breast cancer, but there are several other health systems nationwide that have already been using this technology. I have a link to those reports and ways you can advocate for yourself inside this story at WTKR.com.